Hello, everyone. Welcome to Physi's Medical Science channel. When people hear the word cancer treatment, the first thing that often comes to mind is chemotherapy. In fact, some people use the word chemotherapy to describe almost every anti-cancer drug, but that's actually a very common misconception. Thanks to advances in precision medicine, cancer treatment has become much more diverse. Today, in addition to chemotherapy, we also have targeted therapy, immunotherapy, hormone therapy, and many other treatment options. In other words, chemotherapy is just one type of systemic cancer treatment. It doesn't represent all cancer treatment. So today, let's take a closer look at one particular important approach, targeted therapy. So, what exactly is targeted therapy? To understand it, we need to understand what is a target. Every cell in our body contains thousands of different proteins. Each protein has its own job. Some receive signals, some control cell growth, others regulate cell division or carry out essential cellular functions. Under normal conditions, these proteins work together to keep cells healthy. However, where certain proteins become abnormal, for example, because of gene mutations, gene amplification, or overexpression, they can continuously send growth signals, promote uncontrolled cell division, and prevent damaged cells from dying. These abnormal proteins essentially become the driving force behind cancer growth. That's why they become therapeutic targets. Targeted drugs are designed to recognize these abnormal proteins, block their signals, and slow or stop tumor growth. So, in simple terms, a target is usually an abnormal protein that drives cancer growth. In clinical practice, targeted therapies can generally be divided into three major categories. The first is small molecule targeted drugs. They are usually taken by mouth and are small enough to enter cells and block abnormal signaling pathways. The second is monoclonal antibodies. These are much larger molecules and are usually given by intravenous infusion. They mainly work on targets located on the surface of cells. The third is antibody drug conjugates, or ADCs. You can think of them as a guided delivery system that uses an antibody to carry a powerful anti cancer drug directly to cancer cells. Although these three types work in different ways, they all share one key features. They precisely target specific molecules involved in cancer growth. But targeted therapy is not suitable for everyone. It only works when the tumor contains a matching target. Let's look at two simple examples. Patient A has small cell lung cancer with a EGFR mutation. Because that mutation is present, an EGFR targeted drug such as osimertinib can effectively block the abnormal signaling pathway. As a result, the treatment is much more likely to work. Patient B, however, does not have a targetable mutation. In this situation, giving the same targeted drug would probably have little or no benefit. It's not because the drug is ineffective, it's because there is no target for the drug to act on. So, how do doctors know whether targeted therapy is appropriate? The answer is biomarker testing. Often using tumor tissues or sometimes a blood sample, these tests can help identify whether the tumor carries targetable genetic alternations. Only then can doctor choose the most appropriate personalized treatment. So finally, let's compare targeted therapy with chemotherapy. Um, is targeted therapy better than chemotherapy? The answer is not necessarily. This treatment work in different ways. Chemotherapy acts like a wide net. It attacks rapidly dividing cells, including cancer cells, but also some healthy cells. That's why side effects such as hair loss, nausea, vomiting, and bone marrow suppression are relatively common. Targeted therapy, on the other hand, is more likely a precision-guided missile. It specifically recognizes molecular targets in cancer cells and acts much more selectively. As a result, it often causes fewer effects on normal cells, although it can still produce side effects depending on the drug. Most importantly, targeted therapy only works when the appropriate target is present. So, targeted therapy isn't simply better than chemotherapy. There are different treatment strategies designed for different patients and different clinical situations. In our next episode, we will use EGFR and HER2 as example to explore why cancer cells develop these targets and how targeted therapies are able to work so precisely. Thanks for watching, and I will see you next time.